Welcome to the New England Journal of Medicine at the annual meeting of the European Society for Medical Oncology. I'm Stephen Morrissey, Managing Editor, and I'm talking with Eric Rubin, Editor-in-Chief, and Oladapo Yeku, Associate Editor of NEJM Evidence.
We're discussing the Destiny Breast 06 study, Trastuzumab Deruxtecan after endocrine therapy in HER2-low and ultra-low metastatic breast cancer. Yeku, this study looked at breast cancer patients whose tumors express hormone receptor but had low or very low levels of human epidermal growth factor receptor 2, or HER2, and whose disease had already failed endocrine therapy. What do we do for these patients currently?
Eric, in these patients, the types of endocrine therapy used are typically recycled and or combined with cyclin-dependent kinase inhibitors if they had not had previous exposure to this class of drugs, or with other targeted therapy. In patients with visceral crisis, clinical trials or chemotherapy is usually recommended.
And then, Eric, how did this study work and what were the results?
Steve, patients who had hormone receptor-positive tumors, but which expressed either low or what the authors describe as ultra-low levels of HER2, were randomized to receive either Trastuzumab Deruxtecan, an antibody that binds to hormone receptor and delivers a toxin, or the treating physician's choice among a few chemotherapy regimens. The primary endpoint was progression-free survival in the HER2-low population, with a secondary endpoint of the same analysis in the entire population. A total of more than 860 patients were randomized. Progression-free survival was more than 13 months in those who received Trastuzumab Deruxtecan and about 8 months in those who received chemotherapy, a significant difference. The results appeared similar in those with ultra-low HER2 levels, suggesting that there is enough receptor present to engage the immunotoxin. Trastuzumab Deruxtecan was associated with more adverse events, including, in particular, severe interstitial lung disease. Yeku, what implication does this have for therapeutic sequencing in this patient population?
This study supports the hypothesis that antibody-drug conjugates, such as Trastuzumab Deruxtecan, are effective in earlier lines of treatment, even when patients have not been exposed to conventional cytotoxic chemotherapy.
Are there any factors that a patient or physician might want to consider when thinking about Trastuzumab Deruxtecan in contrast to chemotherapy, such as, say, toxicity?
Eric, in this study, the incidence of all-grade treatment-emergent adverse events were similar for both arms, but the nature of these toxicities were different. For example, with nausea and fatigue and alopecia being more common with Trastuzumab Deruxtecan, this is in contrast to neutropenia, hand-foot syndrome, and fatigue being more common in patients randomized to the chemotherapy arm. Interstitial lung disease remains a potentially serious adverse event in patients receiving Trastuzumab Deruxtecan that requires ongoing vigilance.
Thank you, Yeku. Thank you, Eric. The report of this study is now available at nejm.org.